Good afternoon, ladies and gentlemen. Today, I am quite delighted to introduce Dr. Paul Plummer, the Dean of the University of Tennessee College of Veterinary Medicine. A third-generation alum of the University of Tennessee, Knoxville, he graduated with a Bachelor of Science degree in microbiology and his Doctor of Veterinary Medicine degree from the University of Tennessee College of Veterinary Medicine. And he and his family, I might add, maintain active farms today. Dean Plummer previously served as the Associate Dean of Research and Graduate Studies for the College of Veterinary Medicine at Iowa State University and as a professor. Dean Plummer became the sixth dean of the UT College of Veterinary Medicine on July 22nd, 2024, during the college's 50th anniversary. The college was founded in 1974 and celebrated 50 years of service to the citizens of Tennessee and the science of veterinary medicine in 2024. Likewise, UT is one of only 33 accredited colleges of veterinary medicine in the entire United States. Dean Plummer attributes his academic career partly to his early experiences growing up in East Tennessee and Pennsylvania. As a youth, he spent summers working cattle and goats on his family's farm in Sevierville, and he lived there full-time during his undergraduate studies and while attending veterinary school. He also helped his uncle on veterinary farm calls. Early in his childhood, he attended field days with his grandfather at what is now the Northeast Tennessee Ag Research and Education Center. That was the first of many interactions that he would have with the UT Institute of Agriculture, and it left a lasting impression on him of what it means to work to improve the lives of rural communities and agricultural producers around the state. After completing his DVM at UT, he spent a year at the Texas A&M University College of Veterinary Medicine in a rotating internship in large animal medicine and surgery. However, rather than to stay at Texas A&M for the large animal internal medicine residency, guess what? He returned home to Knoxville for 3 years as a resident. And he saw cases in the hospital and assisted private practice veterinarians in the area with consultations and continuing education classes. From Knoxville, his academic path led him to Iowa State University, where he completed a PhD in veterinary microbiology. And subsequently, he accepted an invitation to serve as an assistant professor with clinical and teaching responsibilities. From there, he progressed to full professor, and he was named the Anderson Endowed Chair of Veterinary Sciences in the Department of Veterinary Diagnostic and Production Animal Medicine, an honor bestowed upon an alumnus of the Food Systems Leadership Institute, where his funded research had totaled more than $35 million. Dean Plummer also served as the Associate Dean of Research and Graduate Studies for the College of Veterinary Medicine at Iowa State University, and also as a full professor. Likewise, he served as the Executive Director of the National Institute of Microbial Resistance Research Education, a national membership organization of more than 50 academic, industry, and affiliated stakeholders hosted by Iowa State University. He has continued that involvement with this organization and the opportunity to engage the University of Tennessee more broadly in these efforts. Dean Plummer also serves as the chair of the Presidential Advisory Council on Combating Antimicrobial Resistant Bacteria, which provides recommendations to the federal government regarding the national response and policy that is related to this very critical health challenge. But among his other notable academic achievements, he is a diplomat of the American College of Veterinary Internal Medicine in large animal internal medicine. He's a diplomat of the European College of Small Ruminant Health Management, and in 2021, he became an honorary diplomat of the American Veterinarian Epidemiology Society. The College of Veterinary Medicine is one of the 4 units of the UT Institute of Agriculture. Dr. Keith Carver, who is Senior Vice Chancellor and Vice President, who spoke last year to Kiwanis right at this very time, commented about Dean Plummer's selection, and he said that he was excited about both his professional and personal experience that he brings to the role of dean. And he characterized him as an innovative thinker, a collaborative partner, and a passionate believer in the land grant mission. When Dr. Plummer was hired as dean of the college, Chancellor Donde Plowman said she was thrilled that such a distinguished alum would now lead UT's nationally recognized College of Veterinary Medicine, and that she saluted his extraordinary practice that's taken him all over the United States and indeed the world. And she remarked that UT couldn't be more excited than to welcome him back home to Rocky Top. Now, ladies and gentlemen, today we too couldn't be more excited to welcome him from Rocky Top to the greater East Tennessee Rocky Top. Ladies and gentlemen, please give him a warm Kiwanis welcome.
Well, thank you very much. I am thrilled to be here. I think the most important part of all of that was I'm a 3rd generation alum of UTK. Go Vols. So, and as was mentioned, thrilled to be back here in Tennessee. Not only am I an alum, but as mentioned, I spent a lot of time here as a child. My parents were both higher ed professors, and so all of the family farmed here in Tennessee. My maternal side here in East Tennessee in Sevierville, my paternal side in Middle Tennessee, but my parents were college professors up in Pennsylvania, so they were on 9-month contracts. So we spent 9 months of the year in Pennsylvania and 3 months of the year here in East Tennessee, all the holidays and everything here. But it goes deeper. My granddad was a county extension agent for Lee County, Virginia, after he returned from the war, and did that for a number of years before retiring back to the family farm there on Boyd's Creek in Sevierville. He grew up here, up in this area. The Lyles, you may know there's some businesses around here, Lyles, and so that was my maternal grandparents. And so spent a lot of time kind of up in this area as a child, and thrilled to be back here in East Tennessee. We still, as was mentioned, we still farm. We have cow-calf operation as well as milking dairy goats. I was in the barn milking dairy goats in the milking parlor at 4:30 this morning. Y'all are welcome to join me in the morning. We'll be back out there at 4:30, me and my kids. And so certainly appreciate the introduction academically. Important to know about my family as well. My wife is also a veterinarian. She graduated 2 years behind me and was on faculty at Iowa State with me until our youngest child reached schooling age. And she decided, she came one day and she said, I teach vet students all day long. I'd rather stay home and teach our kids. And I said, yeah, let's do that. So she homeschools our kids. We have 5 children. My oldest is 18. My youngest is 7. And so they keep me active outside of work. And so just as I mentioned, so excited to be back here in East Tennessee. We moved to Iowa. I think when we moved out there, we thought we'd be there for 4 or 5 years while I did my PhD. We ended up spending 20 years there. Certainly loved Iowa State. All my kids born there in Iowa. Iowa's not many people from around here spend much time in Iowa, and when I told my wife, hey, I want to go to Iowa to do a PhD, and kind of wonder why did you want to go to Iowa to do a PhD? Recognized I was coming right out of my residency right after 9/11, and I'm a large animal internal medicine. I do food animal medicine, but I also have a strong passion in microbiology, infectious disease, and so bioterrorism was a huge focus at that time. And Iowa State College of Veterinary Medicine there in Ames, Iowa, is the National Animal Disease Center, which is the CDC equivalent on the animal side. And so Ames, Iowa is kind of a long-standing national leader in infectious disease, bioterrorism, zoonotic disease, transmission of disease from animals to humans, and those types of things. And so I said, that's where I want to go do my PhD. And my wife said, do they grow potatoes there? And I said, no, that's Idaho. Iowa's more in the middle part of the country. I was kind of like, where did you get that? And then after living in Iowa for 20 years, I could tell you, everybody goes, you grow potatoes there, right? And it's like, no, we grow cows and pigs, lots of pigs and lots of corn and lots of soybeans, but and no hills. And so, but we're thrilled to be back here in East Tennessee. My wife's from Farragut, so this is home for her too. So our 5 kids are back around their grandparents, their cousins, and we're back to our alma mater, and couldn't be happier. So I didn't put together any slides. I thought I would share a little bit with you about the vet school and the landscape in veterinary medicine today. And I have put together, or have passed around, I'm not sure I brought enough for everybody, but put on the table some of these handouts. And so we might talk about a little bit of information off of those as we go through. But as was mentioned, we're one of 33 vet schools that is accredited here in North America at this time. So it's a very small number of veterinary programs in the country. Now, we are seeing some changes in that, and in fact, there's 14 other vet schools that are in the process of opening. But with those is a very different kind of model. So ours was one of the traditional vet schools that we have a teaching hospital. And we'll talk a little bit about that, but an academic medical center, if you will, where our students go through their early part of their career or their training, in the classroom, spending time down in the hospital as well. And then they spend their last 15 months largely in our teaching hospital, seeing cases alongside our faculty. And so that's traditionally how all veterinarians were trained. We now have a progression where most of the newer vet schools are opening what's called a distributed model. And so in those cases, they go to class there at wherever they are at in these new schools. And then they don't have a teaching hospital. And so then at that point, they go out and they spend time in private practices, working and learning the skill set. And so certainly, in an effective manner, we have folks that are coming out with that training. But it's a very different type of training. You're not being trained alongside faculty members or specialists. You're being trained in practices and learning the skill set that's going to be important as you go out and serve in the practice, but not necessarily being as involved in research or some of those other opportunities. And so that's a big change for our profession. We're seeing a significant kind of change, and certainly there's advocates and non-advocates of both of those methods of training, and we don't need to get into that today, but just suffice it to say that we're extremely proud of what we have at UTCVM, where we have this academic medical center that is known, not only here throughout the state, but also nationally for the expertise and training that we provide. So we have 4 classes. So generally in vet school, most of our students enter vet school after they graduate with an undergraduate degree. Some of them may get an early acceptance and come in before they've completed their undergraduate degree, but the majority have an undergraduate degree. And it's a 4-year program. So they're committing to 4 years. First 2.5 years in the classroom, and then in our case, the last 1.5 years, roughly, in the training hospital. In terms of hospitals, we have a veterinary medical center that has all of the same specialties that you would see in a human hospital. So we have board certified specialists in, I'm not going to name them all, but just to give you a flavor: cardiology, ophthalmology, internal medicine, soft tissue surgery, orthopedic surgery, dentistry, behavior, nutrition, large animal internal medicine, large animal surgery, equine rehabilitation, and sports medicine. And so all of these specialties require additional training, typically 4 years of additional training and tests beyond vet school. So most of the faculty in there have spent, if you counted their undergrad, at least 12 to 15 years in advanced training beyond high school to become certified in those. And then if they do a master's or a PhD, probably another 4 or 5 years on top of that. So we're excited to have the outstanding faculty that we have, and really proud of what our students learn as they have the opportunity to work alongside those folks in their daily clinical training during the hospital. So we service about 38,000 patients a year at our hospital there in Knoxville. The majority of those, particularly on the small animal side, are referral only. So the only real small animals that could come into our hospital without a referral would be UT employees. So we do provide routine care for UT employees, students, faculty, staff there on our campus in UT Knoxville. And then exotics, we do primary care exotics, everything from lots of backyard chickens and that type of stuff over to reptile snakes. We do New World primates, so pet monkeys, pocket pets, you name it. We pretty much see it, and we provide all of the veterinary care for the Knoxville Zoo as well. And so our team and our students, our faculty, are out at the Knoxville Zoo, as well as a couple of other places. You may not be aware, but we have an elephant sanctuary here in Tennessee. Who would have guessed? But Holmwald, Tennessee has the only elephant sanctuary in the country. And so we work with them some. We have Tiger Haven that has a large cat operation, rescue, so lions, tigers, cheetahs, those types of things. They have about a little under 300 large cats. We provide veterinary care for them as well. On the large animal side, we do both field service, so we go out within about a 40-mile radius and take care of animals on folks' farms. And then we also have a in-house hospital where we see certainly horses and cows, but also camels and oxen and goats and sheep and llamas, alpacas, you name it, we kind of see it. So it's an exciting place to be. You never know. I was taking a tour of folks through, I don't remember if Laura was with me, and I need to introduce you in just a minute, but I was taking a tour of folks through the hospital the other day, and we walked into ICU, and there was a sloth in the ICU. And that's just like an everyday occurrence. Not always a sloth, but you never know what you're going to find. And so it's a phenomenally fun place to be. While I'm thinking about it, I want to introduce two folks that are with me here. So I've got Laura Zimbrick is with me. Laura's with the UT Foundation, and she is very involved in working with us in our advancement team and philanthropic giving, grateful clients, capital projects, building expansions, key in that process. And then Stephanie Boyd is with us as well. Stephanie works with our referring veterinarians. And so, as I mentioned, most of our hospital is referral cases, meaning that a local veterinarian is going to send them in to us for specialty surgery or workup for cancer or something like that. And so we also have a diagnostic lab. And so Stephanie does a great job serving as our liaison between kind of the mothership, if you will, and our entire network of veterinarians here in East Tennessee and beyond, but particularly here in East Tennessee. So, many patients up here, if they need to be referred in, come in down there. And a lot of diagnostic samples, even if collected up here in vet clinics in this area, come down to our facility for diagnostic testing. So I'm excited to have them both here today. Feel free to visit with them if you have interest in that. We're making some vet clinic visits while we're up here as well, and visiting some of our alumni, so making a day out of it. So in terms of our students, we have 4 classes, as I mentioned. We are growing class size a little bit and hope to continue, but right now we're admitting about 100 students per year. So to put that into context, this year we had 2,343 applications. We admitted 100 of those, 2,300 plus applications. Of those 2,300 or so, 270 were in-state, roughly 272 or something, were in-state applicants. So of those, we admitted 75. So 75 out of 275. But that means we had over 2,100 out-of-state applications and admitted 25 of those individuals. So extremely competitive to get in. That's what it looks like when you have 33 colleges of veterinary medicine. And so, but we get to bring in and train the cream of the crop, and are so pleased to have that opportunity. So at any one time, some of our earlier classes, we hadn't grown quite as much. So we just graduated 86 veterinarians last weekend. And to date, as was mentioned, we've been in existence for 50 years. We have graduated 3,100 veterinarians or so into the state. Roughly half of the state's veterinarians are UTCVM alumni at this time. Up until the UT College of Veterinary Medicine opened, Tennessee had a contract with Auburn. So we have veterinarians from all over the country that practice here in Tennessee. But in some of the older veterinarians, you'll see a lot of Auburn grads, because before we had a vet school, Tennessee would pay Auburn to take Tennessee students. And so a lot of our folks that went through school before UT existed went to Auburn, but there's others from many other vet schools. But we're excited that over half, or right at about half, of our current veterinarians in the state are UTCVM alumni. So we have as I mentioned, a teaching hospital there. We provide all of those services. So that is 2 of our roles. We talked a little bit about land grant mission. As a land grant institution, I think Dr. Carver was here last year to talk to you as well. As a land grant, we have 3 primary missions. Education. Well, we do that through training veterinarians. Number 2 is service. In our case, that's through kind of 2 or 3 major mechanisms. Certainly our medical facility, our medical center, is a way to serve our community and our state. Our diagnostic lab is a way to serve our community and our state. And then we have some of our faculty that serve as extension veterinarians. And so many of you are familiar with, University Extension, University of Tennessee Extension. Certainly they have non-veterinary extension agents as well, but we have specific folks that serve in an extension capacity, particularly around livestock and equine side, to provide service to our state. So that's the service mission. And there's a third mission that as a land grant we focus on, and that's research or innovation. And so another important part of what we do is to generate research that then can be translated into the next innovations that are going to impact our state and our community. In some cases, those are the next new drug to treat a cancer in a patient, or the next new surgical procedure that's going to be the next the next innovation in how to improve disease outcomes for surgical patients. But we also do research that focuses even entirely on human medicine or disease transmission between animals and humans, or in some cases, more broadly in epidemiology or public health or food safety, all of those types of areas. So our research mission is not exclusive to, companion animals or just veterinary care. It's broader in the sense that one example of that was mentioned, I personally do a lot of work in antimicrobial resistance. It's a complex issue we're not going to talk a lot about, but what I want to point out there is we have limited antibiotics, and we use all of the same antibiotics in animals that we use in humans. When we use antibiotics, the bacteria develop resistance and the antibiotics stop working. That's a natural progression of what we do. But as our pipeline for new antibiotics is drying up for a whole bunch of reasons we could talk about sometime else if you want, we have to be cautious as veterinarians how I use antibiotics, because the emergence of that resistance could impact if those antibiotics work the next time a human or you need an antibiotic. And so that's an example of a space that we call One Health, recognizing that the health of humans, animals, and the environment is all intermixed. We can't separate those out. And so very much we talk to our students about recognizing that while we're training you in the healthcare of animals, you need to be very cognizant every day of how that healthcare that you provide impacts the health of humans and the environment around you. And that takes on various different forms depending on the particular patient or the situation. So you can see on that one handout, if you look at this is an image of our medical complex as well as teaching complex there, right along Neyland Drive, right down from the stadium. And we are landlocked, which poses some problems, but we're excited and hope, plan to do another hospital expansion starting planning here in the next couple of months. In total, we have several hundred square feet of close to 400,000 square feet. Sorry, not 100, close to 400,000 square feet of space that we occupy in our main facility, as well as other facilities around the kind of main campus or immediately adjacent to campus there. We maintain teaching herds of sheep and cattle and horses and goats, as well as see a lot of small animal companion animals, and provide also services to shelters throughout East Tennessee. So we also have a mobile clinic, big trailer. You may see it sometimes going up and down 81 or something like that. 32-foot trailer. I think we have 3 surgical tables in there, full anesthesia, can run off generator, and recovery pins in there. And so basically a vet clinic on wheels that predominantly spends every day going out and helping provide spay-neuter services for shelters around East Tennessee, but also serves as a resource during the floods last fall. We deployed that up here into East Tennessee to provide routine veterinary care in some areas that the vet clinics had been destroyed. And so we had to take the spay-neuter, well, you had to cover up the spay-neuter. The first time we were in a Tractor Supply parking lot, and people showed up to get their dogs spayed, and it's like, we are in the middle of a disaster. Like, now's not the spay time. We'll cover up the sign that says spay neuter. We're here to provide emergency veterinary care. But we're so thrilled with the work that they do. You can also see on the back side of that same sheet some quick facts about what we do. We're excited to be Smokey's veterinarian. That's probably one of our claims to fame, is that we get to spend time with Smokey, and certainly excited about that. Obviously, making sure our students are successful when they graduate is really important. not all veterinarians, if there's jobs as a veterinarian that folks can do that don't require licensure, but the majority of our students are going to go through and they're going to practice veterinary medicine, and so they have to be licensed. So we're pleased to say we have a 96% pass rate on our national board exam for those, and some of that 4% that doesn't, some of them never even take it. Some of them, if they want to go work in research, we have a number of folks. We've got one that just got commissioned into the military service. Veterinarians are key in the military service. Thank you all for your service over there. Probably others, veterans in the room, but a lot of folks don't recognize the role that veterinarians play in that process. So veterinarians provide 100% of food inspection around the world to our military troops. And so that falls under the veterinary corps. We also provide services to working dogs, military working dogs, as well as horses, cavalry, and on most installations around the world, there's going to be a vet clinic there staffed by our military veterinary corps that's going to provide, not only the assistance for those military working dogs, but officers and enlisted folks that have pets wherever they're stationed around the world. So, and a number of the military research centers are also run by veterinarians as well. We have an alumnus, Chad Black, that we're very proud of. Veterinarian, and been in the military his entire career. He most recently was up working on research at Walter Reed and leading training, but then last year got deployed, and he's the first veterinarian to manage the entire South Korean military hospital complex. So we have a veterinarian managing the human health hospital complex of the military in South Korea. And so just the impact that those make. So, a number of folks like Chad, they may never have taken the national board exam. So I just want to recognize that 96 pass rate's good, but that 4%, it's not necessarily that they didn't pass. There's a number that may not have taken it because they chose a career that's outside of needing to take that national board. You can see a number of our other partners on there, as well as the spay clinic, and then some more information about our research impetus as well. On that other sheet, that shows you a little bit of the kind of demographics that we provide service for the state in. And so some of those numbers we already went through. But if you look at the map, the color coding demonstrates how many referrals we get from those counties. So you can see we obviously have a heavier referral base here in East Tennessee, as you'd expect. We're closer. There are some other smaller referral centers, private practice, smaller referral centers in Nashville, Memphis, and those areas. But the orange number is the number of current UTCVM alumni that we have practicing in those counties as well. And so we impact almost all of the counties in the state. So that's a bit about, the college, our students, and what we do. Recognize, as I mentioned, we're also part of the UT Institute of Agriculture that Dr. Carver talked to you about and last year. And so as part of that, we have 3 partner institutions within UTIA, or partner service. One of those is the Herbert College of Agriculture, and so they're located across the road from us, and then UT Extension and UT Ag Research. And so those obviously align with our land grant missions, and so we partner with those entities as well as main campus in looking for ways to further the health and well-being, not only of animals here in the state, but also humans and our farming. In terms of challenges, as we think about what does the future of veterinary medicine look like, and how do we continue to provide care, one question that often comes up is access to care. And so particularly in a state like Tennessee, this was true in Iowa, and a lot of larger agricultural states that have rural environments. One of the challenges is keeping veterinarians in rural environments. We have counties in the state that don't have a single veterinarian that does even small animal work in them. And so, that obviously poses problems for pet health care, but it also poses significant concerns for livestock farmers and those that need that veterinary care. And so the challenge is, how do you get veterinarians to go back to those counties and serve? And I'll tell you, it's a complex issue. It's a very complex issue. Um, we have over half of our students say that they would be willing and interested in going back to rural communities and practicing. But when they graduate, the majority of them end up not doing that. And so when you talk to them about why, in many parts of our state and other states around the country, they can take a job doing small animal care, small animal hospital, working 3 to 4 days a week, no night times, no weekends, and make twice as much money as they can going into a rural environment where they're going to be on call if they're the only veterinarian in the county 24/7 for their entire career. And I think you can appreciate that there's a lot of students that say that looks like a better option, to have some weekends if they have a young family, or hobbies that they like doing. It takes a different level of commitment to go back into a community where 24/7 you can't take vacation. I was visiting. I had breakfast yesterday with one of our rural food animal veterinarians here in East Tennessee, even. And he looked across the table and he's like, "My wife and I haven't taken a vacation in 20 years because we can't leave the practice, because when we leave, there's nobody there to take care of everybody in the county." And so that level of commitment, sometimes not making a lot of money in the time that many of he might drive 45 minutes or an hour one way to get to a farm to deliver a calf. Let's say he's there for 30, 45 minutes, drives an hour back to his clinic. In that 2 hours and 45 minutes, he probably could have seen at least 8 to 10 small animal patients, and charged a doctor fee for each of those to return and make a salary himself in that case. But if he charges anywhere near that amount of money for the calf delivery, then it's not an economically viable option to have him come deliver the calf. And so the economics is a huge issue, particularly somewhat here in Tennessee, but you move out to Montana, or even a lot of times people don't think about it, even out on the coast with aquaculture. We have pen-raised fish out in the ocean. Well, those vets have to take a boat trip 3 hours one way to go out and look at the fish and come back in. And so, just the distribution in states like Montana or Colorado or others, where they literally one way might be a couple hours, then provision of veterinary care in those areas becomes very economically challenging. Vet school's not cheap, and we have rising student debt. Many of our students at a national level, most of our students graduate with roughly, give or take, depending on the college, $200,000 in debt load. And so if they go, we sometimes see our students go into rural communities and say, "Well, I want to buy the practice that's looking to sell." They go to the bank and say, "Can I get loaned to buy the practice?" And the banker's like, "No, you already have $200,000 in debt with, you can't. I'm not going to lend you more money to buy a practice." And so sometimes it's that they want to return to those communities, but they can't afford it financially because they don't have, the support. And then sometimes it's just that, that they don't have other ancillary opportunities. So I know a group of 4 young ladies that graduated from a vet school in Texas. They wanted to go to a very rural area outside of Amarillo, Texas. Didn't have any veterinarian for a couple hundred miles radius and stuff. But they all wanted to go there. They all had young kids, and there was no childcare. And so, as a veterinarian that's going to be on call and stuff. How do I go into a place? It was, 2.5 hour ride to get to a pediatrician. And so for a young family to make that commitment, in that case, the four of them banded together and they started their own daycare center, and entirely populated by them and their staff's kids. But they got innovative and they solved the problem. But they had to do that with a commitment that all four of them were going to work together. If one had wanted to do that, it wouldn't have worked. And so I think there's lots of innovative ways to do that. But I guess what I want to leave you with on that challenge is it's not as simple as graduating more vets. and so there's a number of different places where, and as these new vet schools open, one of the rationales that's often voiced is, well, we don't have enough vets. We need to get more vets in the rural areas. Graduating more vets doesn't always solve the problem. And we've been doing that more and more, and it's not solving the problem yet. And so we have to think more holistically. And so at UTCVM, we're working with Tennessee Veterinary Medical Association, Tennessee Farm Bureau, Tennessee Department of Agriculture, and a number of other stakeholders from rural communities that need to increase their veterinary access, and finding ways to try and do that. So that is one of the challenges we face. Another one that I would just raise quickly is, as we have this proliferation of vet schools, almost a 50% increase in the number of vet schools. We got 33. We're looking at an additional 14 coming online. Faculty is a challenge for us as well. Most of my faculty could double or triple their salary by leaving academia. We can't see the number of patients a day that a high throughput small animal practice could, because we have to teach students. It takes a lot more time to see a patient with if you ever have a referral that comes to UT, you're going to come in the front door, you'll get put in an exam room, and then a vet student's going to come in and meet with you, take a history, do an evaluation. That vet student's going to come out, meet with the professor, and go through, this is what I found. They're going to come back in together and evaluate the animal. And so, really that one appointment turns into the equivalent of 2 or 3 appointment time-wise. And so we can't simply turn through as many appointments. And so compared to private practice, where you're generating revenue every time you see an appointment. So, we don't have pay nearly as high as private practice. And so the folks that we have, the wonderful thing about that is the folks that we have, they're not there because of the pay. They're there because they have a passion to teach vet students. And that's what keeps them going, and that's what we benefit from that. My concern, though, is as we have 14 new vet schools, that's about 1,000 new faculty that somewhere we have to find. And we have positions at Iowa State, University of Tennessee, Georgia. Every vet school right now has open positions. We have a nuclear oncology position. Treatment of cancer using nuclear medicine that we've had open, and we're looking for the last 3 years and can't find somebody to that has that specialty to come. As we add new vet schools, we're spreading out our faculty over even more places, and so retaining faculty is a challenge. So those are some of the areas that the challenges we face. Would be happy to comment on other areas, but I think right now I'll open it up. I'm not sure how long we have, but open it up for some questions.